for example, and patients having a heart attack, things along those lines. But short of those really, really severe, very, very acute settings that are managed best in an emergency room, your average 16-plus weeker will be shipped up to triage. We'll talk about that in a minute. For the patients that are less than 16 weeks, or if a patient just walks into the hospital, bypasses the emergency room on her own, and then walks up to triage, and she's found to be less than 16 weeks, the minimal age in our example, then they will be escorted down to the emergency room and seen there. Oftentimes, in many academic centers, there's sort of an OB service and a GYN service, and those patients are oftentimes relegated to the gynecology service. So these are essentially first trimester or very, very early second trimester patients. And the overwhelming majority of those patients are really vaginal bleeding in pregnancy. That's probably the lion's share. Probably the second most common would be like nausea, vomiting of pregnancy, and then, everything else that can occur to someone, be them pregnant or not. Right. So those are and then what will oftentimes, I'd say 50-50, really depending on the emergency room. If the ER docs are very comfortable managing those patients, they won't involve the OB/GYN service at all. And if they have a question, then they'll request either a curbside or a formal consultation. So as a general OB/GYN who runs an OB/GYN service, it is not unusual for me to field a phone call from the ER saying, hey, I just want to run something by you, or hey, can you come down and see this pregnant lady? She was too early for triage, but here she is. So that's sort of that, if that sort of answers that question.
It does.
Perfect. So then let's just talk about triage in general. So first and foremost, again, I sort of touched on this a little bit, but the first thing that one will do is really, well, sorry, I'm trying to think how to answer your question as systematically as possible. Take you through the workflow. So basically, patients come
just take me
and
through the flow.
Yeah, of course. So the first thing that a patient does, your average patient, barring, again, those ones that are severely ill, like from a car accident or hemorrhaging or have a heart attack or something along those lines, but your average all-comer patient, they will come to a labor and delivery desk. Usually most labor and deliveries in this country are locked units, and the triage is located within that locked unit. So they'll present to the registration desk. They will register, and then they will oftentimes sit, and the registration unit will call the triage nurse. Most labor and deliveries that have triages have a nurse that's assigned to that triage unit, termed the triage nurse. And then the triage nurse will go out and bring back that patient and bring that patient in, or at least in our institution and most institutions, bring them into the triage unit. And, sort of do a very quick assessment, introduce themselves, get their name, age, gestational age, take a quick nursing history, read, chief complaint, history of present illness, the usual stuff that nurses do. Right. They'll also at that same time, get a set of vitals, and then if the gestational age is appropriate, and if the clinical situation deems it, put them on a fetal monitor, so to begin a fetal assessment as well. And are you familiar with like the electronic fetal monitoring of like the the heart rate monitor and the tocodynamometer and whatnot? You're familiar with those pieces of equipment?
Can you tell me a little bit about those, like what they do and just in brief?
Sure.
I'm
do
familiar
you want to tell
with
me your understanding so I could?
Sure.
I mean,
so what I understand is
we could go high level, medium level, low level.
Absolutely. So what I understand is there's two kinds of sensors. One, and they're both attached to the abdomen. The first one senses the fetal heart rate, and then the second one, which is a toco, senses the uterine activity, especially contractions. And together, both the tracings are on one sheet of paper, and oftentimes if the baby moves, while this is